In America, everyone counts, and the 2020 census is how that great promise is kept. Respond today online, by phone, or by mail, and help inform hundreds of billions in funding for education, health programs, and more. Shape your future. Start at 2020census.gov. I want to talk about this other thing that happened in the debate, y'all, where Donald Trump brought up, just play the audio, y'all. This Lord.
The waiters?
The herd.
Waiters?
The herd. The herd. Do y'all have the video? Listen, watch this, y'all. Watch this.
Okay, and it is going away, and it's probably going to go away now a lot faster because of the vaccine. It would go away without the vaccine, George, but it's going to go away a lot faster with it.
It would go away without the vaccine?
Sure, over a period of time. Sure, with time it goes
And many
away.
deaths.
And you'll develop herd, like a herd mentality. It's going to be herd developed, and that's going to happen. That will all happen. But with the vaccine, I think it will go away very quickly.
Got to take a quick break.
But I really believe we're rounding the corner, and I believe that's strong.
As you know, Dr. Fauci disagrees with that.
Well, I mean, but a lot of people do agree with me.
See, that's what you asked him. Who?
Let me bring up Dr. Alexia Gaffney, an infectious disease expert. Doc, this fool just said, even with the vaccine, it's just gonna go away. Viruses just don't go away.
No, they don't, Roland. I mean, if you're going to jump out of your lane, at least speak the right language. It's not herd mentality, it's herd immunity. And it would take for at least 70% of the United States population, you're talking about 200 million people, to become naturally infected with COVID or vaccinated in order for us to gain or develop herd immunity. But the problem is talking about natural herd immunity means that you're just willing to risk more than the approaching 200,000 American lives we've already lost in order to achieve herd immunity. The virus is not just going to go away.
I want you to hold that point. That was a guy, he sent a tweet out, and he, let me switch. I want to show this, y'all. And I just want to get your thoughts on this, because on this whole notion of herd immunity. This is what he, hopefully I can show it. This guy, Kyle Felster. Kyle is he's a breaking news editor at CNN. This is what he said. There are approximately 328.2 million people in the United States. To get the low end of herd immunity, about 60% of the population must catch COVID. That's about 196,920 cases. The current U.S. death rate is about 2.96%. So that means in order to achieve herd immunity, we would have to accept 5,836,679 deaths.
Unacceptable.
So is that calculation correct, that we would have to, so to accept herd immunity, we would also have to accept not just the COVID infections, but the COVID deaths that come from herd immunity?
And that's a conservative number, in terms of the number of
5.8 million.
I'm calling it conservative because if you had that many deaths, imagine how many people are going to require hospitalization. We didn't see peak numbers of COVID all over the United States at the exact same time, but where we had hotspots and epicenters, our health systems were overwhelmed. If we stop everything, we don't do anything to prevent the spread of the virus in a ridiculous attempt to achieve natural herd immunity, we will completely overwhelm our healthcare systems, and we will lose even more American people as a result of this virus, way more than that number is predicting, because that number is based on perfect circumstances. Being able to treat those that need to be hospitalized, being able to give everyone who needs it critical care. And we already saw what could happen when our systems become overwhelmed. That is not something that we want to see happening nationwide simultaneously.
This is, so first of all, just explain this herd immunity. There are a number of people who keep saying that's the only way we can do this. They also are suggesting that if you do herd immunity, that once you get it, you can't get it again. That's not true.
No, it's not true that once you get the virus, you can't get it again. Probably a small proportion of people who have been infected will get reinfected, but the reality is we don't know. This is our first time dealing with COVID-19. It's a brand new infection, even though we are 8 months in terms of our knowledge of this virus, but there's still a lot to learn as things progress and evolve. So the concept of herd immunity is that if the majority of your population is immune to an infection that is communicable or contagious from person to person, whether that immunity comes naturally or whether that immunity comes via a vaccination, then you protect the overall population or community or herd, because with less and less individuals susceptible to the infection, then the people who haven't been vaccinated and the people who haven't had the infection are protected because you stop the spread or propagation of the infection. So that number needs to be around 70%. But we already talked about how many lives would be at stake if we allow 200 plus million Americans to become sick with this infection. So we need to continue our social distancing. We need to continue to isolate. We need to continue to wear our masks. We need to continue hand hygiene. We need to continue to avoid large crowds. Everything that we have been doing up until now needs to continue, and it will need to continue even when we have a vaccine available for some time.
I gotta ask you about this here. The CDC director, Robert Redfield, testified today about the importance of masks. This is what he had to say.
Go so far as to say that this face mask is more guaranteed to protect me against COVID than when I take a COVID vaccine, because the immunogenicity may be 70%. And if I don't get an immune response, the vaccine's not going to protect me. This face mask will. I might even go so
Doc,
far as to say that.
Your thoughts about that? What he just said?
Mm-hmm. Yeah. So is a mask better than a vaccine? It's comparing apples to oranges. We still will need to continue to take the isolation and social distance precautions, even when people begin to get vaccinated, because the reality is not everyone is going to get vaccinated, and there's no such thing as a perfect vaccine. So if you're talking about only a particular proportion of the population getting vaccinated and then the vaccine having efficacy or protecting 70% of the people who receive it, there's still some significant gaps that we need to keep in mind. And so we will still need to continue to wear our mask. Nothing in this pandemic situation is a get out of jail free card. So we really just have to be vigilant, and we have to let this thing, in a sense, run its course, but not run its course like take off your mask, go do what you will, return back to life, and see where the cards fall. That's not what we're talking about here. It really needs to be a mass effort, and it needs to be a concerted effort. Everybody needs to be doing the same thing to protect themselves as well as protect one another from the spread of this infection.
Back to our Roland Mark Unfiltered video in just one moment. As our community comes together to support the fight against racial injustice, I want to take a second to talk about one thing we can do to ensure our voices are heard. Not tomorrow, but now. Have your voices heard in terms of what kind of future we want by taking the 2020 census today at 2020census.gov? Now, folks, let me help you out. The census is a count of everyone living in the country. It happens once every 10 years. It is mandated by the U.S. Constitution. The thing that's important is that the census informs funding, billions of dollars, how they are spent in our communities every single year. I grew up in Clinton Park in Houston, Texas, and we wanted new parks and roads and a senior citizen center. Well, the census helps inform all of that and where funding goes. It also determines how many seats your state will get in the U.S. House of Representatives. Young black men and young children of color are historically undercounted, which means a potential loss of funding of services that helps our community. Folks, we have the power to change that. We have the power to help determine where hundreds of billions in federal funding go each year for the next 10 years. Funding that can impact our community, our neighborhoods, and our families and friends. Folks, responses are 100% confidential and can't be shared with your landlord, law enforcement, or any government agency. So please take the 2020 census today. Shape your future. Start at 2020census.gov.